Welcome to Beneath the Branches, a podcast for the Adoption and Foster Care Clinic, where we sit in the shade of shared experience. The heart is normalized and belonging is built, one honest conversation at a time. Join us as we hold space for the messy, beautiful work of building connection beneath the branches. Welcome back to Beneath the Branches. Today I have with me Amy Elmore, our developmental therapist, who's been with our clinic for 23 years. And we are talking about this season, the first 6 months home, and things that are unique to the first 6 months home. So I thought we would talk about development and your perspective. What do you do for our kids in the 6 month home? How can they either access you, or if they can't have access to you, what do they do? What are the important things for the first 6 months home?
So by trade, I'm an occupational therapist, but due to being in this and looking at this and early intervention, I've just been looking at all those areas of development. So for this clinic, especially, I get to look at how the gross motor skills, I get to look at fine motor skills, their cognition, their thinking skills, the way they communicate, their expressive communication, and their social, emotional, and then I also look at their sensory processing skills. So for the immediate, when they first come in, so at an initial, whether it's from foster care or international adoption, I really want to get that foundation of where they are in each of those areas. So a lot of families, and sometimes will say, are you using a standardized assessment? I said, there's nothing standardized or normal about the first initial assessment. It's really looking at how a child is playing and communicating with with the current skills they do have. So I love that first visit is going to really look like I'm typically in the 4, because I'm trying to figure out how to make myself smaller even during that visit so that the child feels safer. And families, I don't feel like I'm talking over them, and I really want to get on their level of what their new normal looks like. And that's why when I look at the therapy ideas, I really want to know not all of the specifics, but I'm looking more at a quality versus the quantity of what they can do. So the quality of how they might move, or how they're trying to move, how they're trying to think, but not exactly that they have 4 words, or they started speaking in 2-word sentences. Those are not the things that matter the most. It is figuring out what they look like within that environment and how they're engaging with objects, with their family and caregivers. And sometimes they may not be engaging in any objects because they're too attached or not working on attachment. So they're working on that being in their parents' lap for that time. So the difference between the development of what I do here and through an outpatient setting is I really just try to get a glimpse, a picture of where those skills are. So it's more of an approximate. So looking at their overall development. So development is about the developmental age at each of those areas would be based on, typically people would think it's how long they've been alive. But I'm looking at where's their foundational skills. So if most children walk between 12 and 18 months old, then they're 3. And so I'll say, well, they're developmentally showing us around a 12 to 18 month old skill. So it really helps families think of a child, because if I'm looking at that, but then I'm looking at their cognition, and they're not able to look for an item that they want in a room, or they're not able to take their eyes off of the parent because they are hyper-focused on where you are, and they're not able to notice there might be something intriguing that another child would like, then I know, okay, then they're cognitively maybe more 6 to 12 months. Again, but they're chronologically 3. So I'm able to really help a family kind of know where each of those areas are, and we typically would expect them to be a year behind. So being a year behind is not something we're going to get overly concerned about. And so I want to stress to families the most that those are not the things that we're going to take care of right now. Those are not the most important things. So coming up with strategies to work on development have to keep attachment and bonding first. So coming up with strategies of how a parent may play with their child, or how, if they can't get on the floor, where would we do it? Being in the high chair, or being in the booster, being in their lap at the table, sitting on the couch together, sitting with siblings. So I want to have ideas that will help them work on some of the development, but through an attachment way and not clinical. I think that's hard. Sometimes maybe families have already looked into, oh, my child's going to need these therapies. And what we kind of say as a team is, let's not get so stuck in the quantity of what they can do, but let's look at the quality and hang out there. We've said that before on other podcasts as well. So I want to look at where each of those areas are: gross motor, fine motor, cognition. One of my favorite things to do is to teach families how to incorporate all of it into one. So if they're maybe a child that's needing to work on balance, and maybe we're even 5, but our balance is poor and more like a 2 to 3 year old, which is typically something we would see. It may be about sitting on the parent's lap, but maybe further out to the knees. Or it may be sitting on the floor doing long leg sitting while we're playing. But it doesn't have to feel like therapy. So the child is now sitting with long legs, and now I'm presenting a couple of toys that are just learning some cause and effect. But then when we're doing that, we're using less words. So I try to teach families to use only a couple of words, like 1 to 2 sentences, like put in, take out, give, do you want more? And that could be with puzzles. It could be with a book. So that way now we've added, we're working on a motor control. We're working on that. Now we're working on language, and we're working on cognition because we're following directions. And we're working on attachment because we're right there seated in front of them or next to them where they know we're doing all the help. So we can hit, and depending upon the toy, it's working on a fine motor coordination. So bringing it all together is really important, especially during those first 6 months.
Because I think that's such a different approach than I've got to go to do weekly occupational therapists where you're going to a private OT and you're going into their clinic. They're working with the child on singular skills, right? And not having that view of how do I incorporate the parent so that attachment progresses and we don't interrupt attachment in this really crucial time.
Correct. One of the best things I learned in this 23 years ago, just over 23 years ago, was our founding OT. And she had brought home her child internationally, and she said it made so much sense with me and resonated with me. And I try to tell so many other therapists out there that when she came home, everybody was telling her, well, the speech was delayed, couldn't use his hands very well. So they recommended right off the bat OT, speech, and then physical therapy because the balance was poor. And she felt so overwhelmed. She couldn't believe she was doing like 3 appointments a week. And this was when we first got started. And we had not even been understanding as much about how much gross motor skills really impacted a 3 or 4 year old at that time. We were just starting to see the repercussions of what happens when the core is weak and how many other things that changes when they're 7 or 8. And she said she felt overwhelmed doing all of those therapies because she knew she could not carry over the activities at home. It was way too many things. And she said, I wish someone had told me either one, she didn't need to focus on it, or focus on one thing. Like what was the most important to her for her survival in their home, being a part of that family, being able to thrive in this new environment for those first months. And that hit home with me so much as a therapist who has not gone through that. And I have used it every day since. And knowing that is exactly, she hit it home, what was the point. If you don't know what is the most important, then how can you work on it each day? And then here's the thought, it doesn't need to feel like work. It needs to feel like play and participating in the family. I have many parents who've said they wish when they first come home, because life's a big interruption at this point, and the families will say they just want to go and have a cup of coffee. And, there's now somebody who needs you constantly. They may be 5, but they're acting more like a 2-year-old because their cognition and their language is there. So maybe now we just want to be able to say, first coffee, then play. Or they can see that. So we're breaking down the words. And a lot of parents will tell me, their children would never look at books those first months home. And I would say, well, let's go back to the basics of, let's just talk about what's on the page. Do you see a sun? Like, if it's always, my favorite example is, I'll say it's a book about babies' first time at the beach. And so on every page, there's a sun and a beach ball. So we just go, oh, where's the ball? It doesn't mean we stop reading. We love that. We know what that brings out in language and hearing that. But what we do know is that it begins to give them English words in very simple sentences. And then you're also working on turning a page. And you haven't overstimulated your child. So now you've just worked on their thinking skills, their fine motor skills, their attachment, and bonding, because you didn't overstimulate them and you made them feel safe. So within that, you have some of those basic activities, and learning that that's a way to address maybe a parent's first concern of, they cry and they're not able to tell me, or they whine and get emotional outbursts because they can't tell us our needs. So how do we work on language? Well, we do it like the way I just mentioned, talking about what we see, giving it simple words. So finding ways to meet the parent where they can handle it, and not bringing more people into their lives that overstimulates them. Because we want to keep their world small as much as we can those first 6 months.
Yeah, and the last thing you want to be doing is carting your child to a bunch of therapy appointments. And I like that I can send them, when they come here, you can see them and say, okay, here's our 3 most important things, and work on it this way, and this will build attachment and build all of these skills. Right. So you're really able to give them a lot for their energy and effort, because everything feels like a lot of energy and effort those first months.
Kind of break it down into, I always say, like, the max we're going to do is a 10-minute increment.
Yes, exactly. But yet hitting multiple points so that the child that you can allay the parent's fears that they're not getting further behind. Right. Because that is a parent's fear. Oh my goodness, I have this child that's so delayed. How am I ever going to catch them? Are they ever going to catch up? And one of the ways to allay that fear is to get started and get working on it. Right. And that might not be the best thing to do that out of the home with multiple therapists.
Right. I love within most states have early intervention, and it's birth to 3. So it goes up to them till they're 3 years old. So that's coming into your home. So in most cases, that's a great way to start doing something different around after being home 4 to 6 months, is looking at, is early intervention something that might come into your home and help teach you what to do. The most important thing, though, is as the parent, is letting them teach you what to do next and understanding that.
I do hear you say that a lot, is, a therapist is 30 minutes or 45 minutes once a week is not going to make a lot of change. They're really the parent's tutor of how do you work on this on an everyday basis or multiple times a day? How do you do this? How do you work this into your family life so that they can more quickly catch up?
Right. We have to find some way to be able to meet them where they're at. Yeah.
And the majority of what we're working on, the ways, the biggest interventions are going to be through incorporating those skills through play, because then play also builds attachment.
Right. And play shows us cognitively what they understood about the environment, what they understood about feeling safe. So when we see those connections, we go, okay, they got it. It's sort of an aha moment for the child and for the parent. Whenever you may not see it, oh, we moved and we've changed our skills by increasing it several months, but we saw them understand and be able to go. Like, one of my favorite things I look for is when a child might be say we're just playing with blocks or colors, and they hand the color off or the block off to the parent, and they do this thing with their eyes. They follow the crayon to the parent like, do you see it? And they follow it back, and then that is that moment that you go, they wanted me to see what they had. And it's that showing communication of, do you see what I've got? What do you think I should do with this? Yes. Can that also be a great look of mischief? Yes. But it's a way to get a glimpse inside their brain of what they are actually perceiving is going on. And we would much rather them want to share this crayon experience or this block experience rather than do it on their own.
So you're looking, while you're doing development, you're looking for cues of attachment being built.
Correct. Yes. And then I love doing it through, a lot of times when we can't do it through just early intervention or coming into the homes, also having opportunities to do, one of the other things we offer now is parent coaching. And I have been able to really explain to some families through teaching them literally while they're at the kitchen table or in their living room floor.
Because this is video.
Oh, yes, video. Sorry, parent coaching through video. Where they're able to now see what I mean, and then they duplicate it. So
I think that's been helpful too, because not everybody can travel to us. Or if they travel to us, it's just once, and then they need our help, but they live far away. So the video coaching, like how in the world does that work? Because you're all about play and you're all about getting on the floor with kids. How does that work with teaching families what to do developmentally or helping a child developmentally when they're states away?
Typically on a Zoom of some kind with a telehealth, and I first try to understand exactly what might be the concerns going on with a family. Where do they see things occurring right now, and give some examples so that I know what to look for. But a lot of the times I do pull out the toys. I do pull out, I've got some great handouts that we've made that I can actually use to send to the parent beforehand. And then I talk them through it. So I actually, many times like that activity where I like to show them, I call it my 10-minute activity time, where we pick 3 toys and I pick maybe a puzzle, a book, and crayons that we're working with, and I show them on through the video. They're able to see me move the toys around, and I coach them on where to put it to maybe help with their motor coordination. I coach them with what might be the best toy to play with and how to get their attention to the toy. Sometimes it's just that. How to help them focus their eyes toward a toy or toward mom who is trying to get them to imitate. And then also doing parent coaching through video for those first 6 months home for eating and oral motor, asking them to show me, what cups they use, what bottles have they used, what does it look like when they're eating. And I'm actually able to see what's going on and then basically give them my favorite tips and tricks that get them to the next level through play and through that one-on-one time that doesn't have to feel mechanical and so physical, because it doesn't necessarily mean they have to be touched by a therapist.
So they're in their own home.
Home.
They've got the toys in front of them. You've got toys in front of you, and you're coaching them.
Right. I've been I've done it before where I usually have families. They have like a long mirror somewhere, and that could be outside of a bathroom or the living room, and I've seen lots of parts of people's homes to get to see a lot of that. But yes, so they can be wherever they are, and we can meet that need.
And that's helpful because you're not introducing a new person to the child. The child's able to stay in the home during those crucial first 6 months home.
That's one of the funnest things to do is to see it through play. And there are many times when those first 6 months home, we have to teach some families how to play, like what play looks like on that level. I've had to do some parent coaching with that, and I thoroughly enjoy it because you get to see those families have those aha moments, and also it decreases their stress. Because when you get that play, you increase communication. When you get that attachment, you increase communication, and it decreases all the stressors, the meltdowns, and those big behaviors you see those first 6 months home.
And I think another thing that you're able to tell people is where their development level is so that they can shift their expectations. And we'll talk about this on another podcast, but say they're chronologically 5 years old, but they're developmentally more a 3-year-old. then it is very important to parent them like the 3-year-old rather than the 5-year-old. And I think that's one thing you're able to give parents, that information, so that they know exactly what level to parent at. And you can do that via parent coaching or in the office, either way. And I think that's been really helpful now that you've started offering that for families that are far away.
Right. Noting that what they can do versus what they have trouble doing, and just meeting it is the whole nother level of helping a family understand. And sometimes I'll say, I know they look as big as a 5-year-old, but we're the size of are we the size of a 2-year-old? You have to give them something to remind themselves, oh, that's right, it's 2.
Yeah.
We're dealing with a 2.5-year-old. And
Right. Yeah.
that's hard. But I mean, sometimes I have to say that.
Because I think as parents are afraid, like, okay, I don't want to treat them like a baby. I want them to gain independence, that kind of thing, especially with older children. But that is the opposite way that attachment is built.
Right.
So you're often giving them permission to treat the baby much younger.
Correct. Correct. And everybody who's working with that child or in the home, grandparents, we all need to know that. And it's important that everyone gets to see that child where they're coming from and where they're going.
And it is not always intuitive that will help the child reach independence later. By treating them younger and parenting them right at their behavioral and developmental level, then that's going to get them faster matched to their chronological age.
Yeah.
Yeah.
And we know that if everybody comes home if we typically expect, even in foster care, a minimal delay of 1 year, then we can look going forward, what is that? Like one of the things we call is that rate of catch up. Like, so do we see now that you were a 5, you had things at 2, maybe your language is at 2 and gross motor skills at 3, 1.5 could be your play and your fine motor. But we look for how do each of those areas, so over 6 months, do they improve by 1 year? Or is our 3-month visit now going to be now we're going to see a 6-month improvement over 3 months? So we really want to watch that, and that helps then a family determine when it is time for outside therapy. If we haven't started it yet, what would we do?
Yeah. So what you're referring to is that rate of catch-up.
Right.
So I think that's something that's very different that you look at in clinic than another OT or developmental specialist, because you're not just looking at where the child is developmentally, because especially when they're newly home, because they're going to be delayed. But there are expected rates of catch-up, and that's what you're watching. Is that rate of catch-up typical for the child's history? Does it match the child's history? Because it doesn't really always matter how delayed a child is. It is more important on, okay, are we doing the right interventions? Is the brain working well enough to catch up?
Correct. And that's usually why typically when we have those visits in person, I will go first or second before they see you, so that we can then round table together so that Amy, is there anything else we should be looking at? And it helps us determine any other testing that might need to be done, any other physicians that might need to be seen, because there can be underlying causes for some of that. And it's not the ones that everybody would think.
Right. And so I think that it's such a neat thing to see that first visit and that 6 months later, and to be able to assess what that rate of catch-up in their developmental skills was.
And I can think of one more really pivotal thing that I would want our listeners to know about development is one of the main ones that typically takes longer to catch up is speech and communication. And that is what we expect. The research tells us it occurs. And to know that when you already know that, you don't have to think, but my child's not talking. And that's sometimes why we do encourage to do some sign language, because the research tells us that sign language itself, using a few signs and pairing it with the word, will improve communication. It does not decrease them giving you words and communication. So typically that is the one area that even in best case scenarios, I'm going to see a delay in at 6 months. And then you know what we do? Then we go and we try to find somebody that's a speech therapist or whoever might be the best teacher in that for that situation. But I typically expect it. And here's another tidbit, is that even if attachment and bonding went well, your speech will still show the delay. And that's also a good cue on whether or not that child's needs were being met quickly. Because people say, well, if I meet it quickly, then they won't ask for it. And so for those especially first 3 months, we say, that's okay. So.
And then it changes after that. Right. Then after that, we change that advice. So.
Right, change that advice, because then after 6 months home, it's kind of a whole nother tough love situation.
We got to get that speech there.
Right. But at least I know we have a foundation for attachment and bonding.
Right.
So now we can build on pushing a little bit.
Right. Yeah, and I think you're really good at knowing and helping families know when can you start pushing. Because that's a hard thing to know. It's a hard thing to know if you're in the moment and you're in the middle of parenting.
It's a fine line, and that way, even as an outpatient OT versus this role, that was it's hard to see. It can blur because your brain is always thinking the next goals. Yeah. But in this scenario, I really need to pay attention to the parents' goals, but also the expectations of what I think the child can handle. Because we do know that if we decrease the anxiety initially and improve the attachment, then we improve our learning. Right. And that goes on to the next idea. Yeah. So it all ties together.
Well, thank you. This is very helpful because it does cause so much anxiety, that when your child is delayed and you want them to see them caught up so fast. So it's really nice to know kind of what our norms are and how to effectively change those developmental skills.
Well, thank you. Thank you for having me.
Thank you for joining us beneath the branches. Thank you for joining us at the Adoption and Foster Care Clinic for another episode of Beneath the Branches, a podcast for adoptive, foster, and kinship care families. We are deeply grateful to our sponsor, Show Hope, for their generous support and their continued work to break down barriers to adoption and support families every step of the way. Until next time, may you feel covered, connected, and never alone beneath the branches.